I'm Lynn. I'm a physician assistant. I have Mara as my patient. She's here today. Her main concern is nasolabial lines, which are these lines relax your face. Hers aren't too bad. What we did about probably 6 months ago, we put some filler in her cheeks to give her a little lift here. She had lost a little volume in here, so we raised those, and I think her cheeks still look good. She has nice volume. We don't really want to overfill. What we're going to do today is just put a little Perlane in here and here, which are the nasolabial folds, just to soften those lines for her. She has had some topical lemon cream on for about a half an hour, which makes her, much more comfortable. And we're going to go ahead and inject her. And this product probably lasts about 9 to 12 months. I usually tell patients, don't let the product fully dissipate. Come back probably about, 8, 9 months. We'll touch it up. A little needle stick. Did you feel that much?
Nope.
The topical lemon cream works very well. The results you see right away. And her lines aren't deep at all. Most people typically need more than 1 syringe. But when we did the filler in her cheeks last October, it provided a lift, so it brought her up. So I don't really like to just fill these lines without treating the cheeks, because then what happens is the lower face really looks too heavy. It doesn't look natural, and so everyone always wants a natural look. Filler just gives a subtle improvement. A lot of times patients come in and they say, I don't want to look weird, I don't want to look like overdone. You're not going to look overdone with filler. It's a very subtle improvement. It just makes you look really more rested. But our look is always trying to achieve a natural appearance, which is what everybody wants. Are you feeling that much, Mara?
Not much.
So the topical lemon cream works very nice. The product also is mixed with a little bit of lidocaine in it, so it does provide some additional anesthesia as I inject her. And this side's a little worse on her than this side. Typically everybody has one side that's a little worse than the other. It's just how they sleep. Maybe they chew their food on that side. So it's common to have one side that needs a little more product than the other side. And there's no restrictions after this. She can put makeup on, she can go about her normal activities. She may have a tiny bit of swelling. Typically that's going to last about 24 to 48 hours. There's usually very minimal bruising. When you treat the nasolabial folds, you usually don't see any bruising unless somebody's been taking a lot of things that thin the blood, like aspirin or certain vitamins like vitamin E, St. John's wort. I don't expect her really to have any bruising. Okay, so we finished Mara's treatment. Her nasolabial folds. Go ahead and open your mouth. I'm going to just hold a little pressure here. She was losing just a tiny bit, but you can see, right away you see the improvement. I mean, it's a subtle improvement. You don't want to really overfill and make her look too puffy. She can put makeup on right away. These little needle marks, they will be gone. Within a couple hours. You're not even going to notice those little needle marks. I'm going to give her a little ice pack to hold on. I'm going to tell her to hold some ice on her for about 10-15 minutes. And then I'll send her home with a little ice pack. She can put some ice pack, on it off and on during the day for the next couple hours. And basically there's really no other follow-up needed. Any questions?
Mm-mm.
How was your treatment?
It was fine. I barely felt it.
Okay, very good.